Hello, I am Andrew, and welcome to our library podcast, Bound to Discover. Our guest today is hearing care specialist Kat Klauer, owner of Hearing Care Services in DeWitt, Iowa. Welcome, Kat.
Oh, thank you. Thank you for having me, Andrew.
Let's get right into the questions. What is your title? I guess I just said that, but
Okay.
and description of what you do.
Yeah. So I am a hearing instrument specialist, and I also own hearing care services here in DeWitt. I do hearing testing, fitting of hearing aids. I do wax removal, and I do tinnitus management. And with my licensing, I can work with people aged 18 and older, so adults only. And my patients pretty much range from age 19 to 103.
103. Wow. Is is what's the oldest?
103 is
103.
my oldest patient, yes.
Wow. Okay. Has this work always been an interest?
If I'm being completely honest, no. Okay, it's been a journey.
Yeah.
This specific line, I guess I would say, was not kind of on my radar or in my thoughts when I was younger.
Hmm.
I have an undergraduate degree from the University of Iowa in the sciences.
Nice.
So I've always been interested in science and in healthcare.
Hmm.
I worked for many years in a medical laboratory in the hospital. I really enjoyed the work and my colleagues, but I didn't enjoy the hours and the shifts of being a
Yeah.
hospital worker.
Yeah.
Yeah. So over time, kind of what happened, I met a couple, and he was a hearing instrument specialist and she was an audiologist.
Hmm.
And they both encouraged me to get the schooling needed to enter this profession.
Nice.
And it really has been a good move. I've been doing this for almost 20 years now.
Excellent. That sounds cool. Yeah, I know a few people in the who worked in hospitals, and the hours are yeah, quite something else. Or yeah, the environment, just everything. Um, did this course spring off another previous related or even unrelated path that, upon reflection, connects in a way you didn't know at the time?
Yeah, I guess I'd have to say I'm surprised how much hearing has kind of tapped into my innate interest in science and healthcare both. When I first started this position, I didn't realize it would really kind of marry those two interests and
Hmm.
foster that. I really enjoy keeping up to date on the newest technology that hearing aids offer,
Hmm.
as well as the medical studies that relate to hearing loss and healthcare. In the past, I did a local radio show for 6 years talking about hearing loss and how untreated hearing loss affects our overall well being. So, when I first started, I didn't really see um, all of this kind of unfolding.
Yeah. You did a radio show, you said?
Yes, I
Nice.
did.
Awesome. Um, let's see. Do you have personal experience, you or someone close, with hearing memory loss?
Yeah, so um, I have a best friend or a good longtime friend who has hearing loss. We met in the second grade,
Hmm.
and I was the only one in the classroom and that had glasses, and she was the only one who wore hearing aids. And I grew up in rural Iowa,
Hmm.
north of Dubuque.
Hmm.
So at that time, anyway, it was pretty uncommon
Hmm.
to have either condition, basically. And we remain friends to this day, but it has been interesting for me to follow her hearing journey because she was born with hearing loss. And now to this day, she has um, gone through different stages of hearing aids to now having a cochlear implant on one side and a hearing aid on the other.
Hmm.
And as far as memory loss, my father and grandfather both had dementia and passed away due to the complications that come with that
Hmm.
disease.
Gotcha. Um, what have been some circumstances, learning experiences, times with a patient, etc., that really impacted your outlook or altered your perspective in any way?
Yeah, I would say this has happened to me a few times over my career. Not something that happens with each patient, but the first time was very impactful. And I think it really showed me how much treating hearing loss can change a patient's relationships.
Hmm.
So, just to give an example, the patient comes in. I typically look in their ears, take their health and kind of lifestyle history. And during that portion, they just kind of dominate the conversation. Like,
Yeah.
I feel like I'm a very patient person, but have a hard time inserting anything or taking control of the
Mm-hmm.
conversation, to the point that by the time they leave my office, I'm kind of exhausted.
Oh yeah, yeah, yeah.
But then they have hearing loss. I treat them with hearing aids, and I typically do a follow up within a week or two
Sure.
to see how things are going. And then they come in and they sit down, and we actually have a back and forth conversation. It's almost like they're somewhat of a different person.
Yeah.
And it's just unbelievable for me to witness that, to imagine how that affects, their friends, their family
Yeah.
in their day-to-day lives.
Yeah, definitely. I think that opening up of communication, for them to be able to kind of, yeah, like it just is, yeah, it just opens up the world in a way that, yeah, just you know, very much that they're able to get engaged with, but like others are, that it's just from, different directions, not
Yeah,
just one sided or feels as enclosed or,
exactly.
forced
I
to be
think
that
it's
way.
pretty common for us to think that people withdraw with hearing loss,
Yeah.
but it was interesting to see that sometimes people will just dominate the conversation because
Uh,
then they have control and know what's being said,
yeah. Yeah.
and seeing it from that view.
Sure. Um, a couple of people in my family have Meniere's disease. Is that how it's pronounced? Is it
Yes, Meniere's.
Meniere's, which was a complex process, to say the least, toward diagnosis. Do ear conditions pair often with certain medical conditions and diagnoses?
Yes. So, first of all, you are correct. Meniere's is a hard disease to diagnose. It's a condition that I myself, in my role, can't determine, but I do know its symptoms, and I always make the appropriate referral to an ENT.
Hmm.
And since most people with Meniere's, they do tend to have hearing loss, they continue to come to see me for the treatment of their loss.
Hmm.
And it is a little bit more specific and more often care
Yeah.
because of the various conditions that come along with the Meniere's.
Yeah.
And yes, definitely, hearing loss has what I call its comorbidities. So this
Hmm.
is the simultaneous presence of different, two or more medical conditions. And as far as hearing loss is concerned, these relationships or medical conditions can be physiological, and behavioral, and many are bidirectional, meaning that each condition can worsen the other.
Mm.
So, of course, the big one is that hearing loss is associated with an increased risk of dementia. And then, of course, hearing loss is also associated with cardiovascular disease, diabetes, balance disorders and fall risk, clinical depression and anxiety, social isolation, and soon here at the library, I'll be giving that presentation
Yeah.
on hearing loss and dementia and how they're related.
Excellent. Um, let's see. What does the tech side look like? What are some major advancements that have been made in recent years or long term?
Yes, so this is a fun question for me. I enjoy this. It surprises me when I have people come into my office. They have really an antiquated thought of what a hearing aid is.
Mm.
They're still picturing what their grandparents wore, which I often call the big pink bubble gum in the ear
Mm.
or the big banana behind the ear. And just kind of like a timeline of hearing aid advancement and technology. Uh, in 2005, which now has been 20 years, we made that transition from analog hearing technology to digital.
Mm.
So, when I think of an old analog hearing aid, I think of a volume wheel on the hearing aid, and people would reach up and kind of screw their ear when it would make too much
Yeah.
noise or they didn't want to hear. So the digital technology in itself has come a long way.
Uh-huh.
And then in about 2010, we made a transition from fitting patients mostly from custom hearing aids, meaning fit to the ear canal, to what we call the receiver and the canal style. And that's what we still see today, the majority of people wearing, because of what they can offer the patient. And that's a very discreet, small, behind the ear hearing aid.
Okay.
Okay. And then in 2015, Bluetooth connectivity first showed itself in the hearing world. And for patients, it's a great way to hear their phone conversations. And, it's come a long way. There are some hearing aids that we offer at Hearing Care Services that you can pair multiple devices to your hearing aids. And I even have one patient who has his aids Bluetooth to his metal detector because that's a hobby he really, really enjoys. And he couldn't hear the beeps without that Bluetooth connectivity.
Wow.
So that's really changed, his hobby for him. In 2017, I started fitting rechargeable hearing aids because at that time, they were then reliable where you could get a full day charge. And that's something that I still do to this day. I'm a big advocate of making it easy, keeping it simple for use. I feel like the simpler it is to use, the more likely you're going to use it. And then about 2022, we really saw the emergence of more waterproof and dustproof hearing aids. And here in the Midwest, that's huge. We have so many farmers, people who spend a majority of their time outdoors, and to have that durability and reliability in hearing aids is good. And then in 2004, we had more pronounced and integrated AI technology. And that has really kind of changed things, and I know will continue to change how hearing aids function moving forward. And kind of what is on my radar, what is of interest to me right now, is that hearing aids now are Auracast capable. So for those who are listening and aren't familiar with Auracast, it's, in my mind, a newer version of Bluetooth. So Bluetooth does have its limitations where it's kind of a one-to-one connection. And with Auracast, in public venues, they're going to be able to send an Auracast signal, and multiple people with their hearing devices, if they have Auracast capability, will be able to connect into that. So imagine a theater or a place of worship or an airport. That's going to be a big thing moving forward as that technology is more widely available.
Yeah. How long does can a hearing aid last?
I would say life of a hearing aid is going to be, they say about 4 to 7 years.
4 to 7 years.
I would say more realistically 5 to 7.
Okay. Interesting. Yeah, I was, that Bluetooth, that is fascinating. I would not have you think of a lot of things for Bluetooth, and then it's like, oh, that makes sense. Like that would work, and that would be so helpful.
Yes, I've had people say, I don't need Bluetooth, I'm not interested in it, but you sit and have the conversations with them.
Yeah.
I had a 91-year-old, and she was, I don't use Bluetooth. I don't even really use a cell phone. But then her daughter was with her at the appointment, which was very helpful.
Yeah.
And reminded her that she uses an iPad.
Yeah.
And that she watches her worship services on her iPad because she can no longer physically go. So I paired her hearing aids to her iPad so that when she's watching the church services, it's coming right into her hearing aids, and she's getting that clarity of what's being said.
That's what we like to focus on at the library, or kind of that's a long-term commitment to connect technology with utility. And that's awesome. Yeah.
Yeah. And I always tell people, don't be intimidated by it. That's my job to do the connection, do the pairing, show you how to use it, and you just get to enjoy it.
Yeah. Nice. What can hearing care services provide?
Okay, so what we provide is regular and routine hearing exams. It is recommended to get a baseline hearing test starting at age 40 and then every 5 years afterwards. I think of it as just your overall health care.
Mhm.
Starting at age 60, you really should get your hearing tested every 1 to 3 years. I'm able to diagnose the type and degree of hearing loss and make the appropriate recommendation, whether the recommendation is to come back in X amount of time to be retested, or the recommendation is maybe I see something that indicates something could be medically correctable, and I would make the appropriate referral to an ear, nose, and throat doctor.
Mhm.
Or if the person has what we call sensorineural hearing loss, the treatment of the hearing loss with hearing aids.
Excellent. Awesome. Well, that's all the questions here. Thank you very much for coming in today and for just
Yeah.
yeah, giving all that information and talking about everything. Hearing Care Services, Kat Klauer.
Well, thank you. And thank you for the opportunity.
Welcome. Thank you.
Many thanks to Kat for stopping in. She will be at the library for our Memory Cafe program tomorrow morning, November 13th, and then again on Monday, November 17th at 1 p.m. for her presentation, Ties Between Hearing and Memory Loss. Join us next time, where we are bound to discover